Hello and welcome. Today, we're diving into a complex genetic disorder that often presents with significant heart complications, Noonan syndrome. We'll explore its causes, how it affects the body, and what can be done to manage it. Noonan syndrome is primarily a genetic condition. It arises from mutations in several genes involved in cell signaling pathways, specifically the RAS-MEPI pathway. These genes, when mutated, disrupt normal development. While some cases are inherited from a parent with the condition, many instances occur spontaneously, meaning the mutation arises de novo, or for the first time, in the affected individual. Identifying the specific gene mutation is often possible through genetic testing, although it doesn't necessarily change the course of treatment. The RAS-MEPI pathway, crucial for cell growth, differentiation, and movement, goes awry in Noonan syndrome. This disruption impacts various developmental processes, especially those related to the heart. The most common cardiac manifestation is pulmonary valve stenosis, where the valve between the heart and the lungs is narrowed, forcing the heart to work harder. Hypertrophic cardiomyopathy, a thickening of the heart muscle, is also frequently observed. These structural heart defects, along with other issues like disrupted blood clotting factors, contribute to the various symptoms seen in affected individuals. Noonan syndrome is estimated to occur in approximately 1 in 1,000 to 2,500 live births. It affects individuals of all ethnicities and geographic locations equally. Due to the variability in symptoms, the true prevalence may be underestimated, as milder cases can sometimes go undiagnosed. It is considered one of the most common genetic syndromes associated with congenital heart disease. The signs and symptoms of Noonan syndrome are highly variable, even within the same family. Common features include distinctive facial characteristics, such as widely spaced eyes with downward slanting palpebral fissures, a short or webbed neck, and low, set ears. Short stature is frequently observed. Other potential symptoms include bleeding disorders, lymphatic abnormalities, developmental delays, intellectual disabilities, and feeding difficulties, particularly in infancy. Critically, many individuals have congenital heart defects, requiring specialized cardiac care. These heart defects often cause symptoms like fatigue, shortness of breath, and chest pain. Diagnosis of Noonan syndrome usually involves a combination of clinical evaluation and genetic testing. Doctors will look for the characteristic physical features and may order cardiac tests, such as an echocardiogram, to assess heart structure and function. A genetic test can confirm the diagnosis by identifying a mutation in one of the known genes associated with Noonan syndrome. It's important to note that clinical diagnosis can be challenging due to the variability in presentation, and genetic testing provides a more definitive answer, especially in cases with milder symptoms. While Noonan syndrome isn't classified into strict subtypes, the specific gene mutation identified can sometimes correlate with certain features or the severity of the condition. For example, mutations in some genes are more often associated with hypertrophic cardiomyopathy, while others are linked to pulmonary valve stenosis. Understanding the specific gene involved can aid in predicting potential complications and tailoring management strategies. There is no cure for Noonan syndrome, so treatment focuses on managing the symptoms and complications. Cardiac defects often require surgical intervention, such as valve repair or replacement, or medications to manage heart failure. Growth hormone therapy may be used to address short stature. Developmental delays are addressed with early intervention programs, including speech therapy, occupational therapy, and physical therapy. Bleeding disorders may require specific medications or transfusions. Regular monitoring by a multidisciplinary team, including a cardiologist, geneticist, endocrinologist, and developmental pediatrician, is essential. Since Noonan syndrome is a genetic condition, there's no way to directly prevent it. However, genetic counseling is recommended for families with a history of the syndrome who are planning to have children. This can help them understand the risk of recurrence and explore options such as prenatal testing. In cases of spontaneous mutations, prevention is not possible. The prognosis for individuals with Noonan syndrome varies widely depending on the severity of the condition and the presence of complications, particularly cardiac issues. With appropriate medical management, many individuals can live long and fulfilling lives. Advances in cardiac surgery and other medical interventions have significantly improved outcomes. Recent research is focused on understanding the precise mechanisms by which mutations in the RAS-MEPI pathway lead to the various features of Noonan syndrome. This knowledge is crucial for developing more targeted therapies in the future. Studies are also investigating potential treatments to address specific aspects of the condition, such as lymphatic abnormalities and bleeding disorders. Ongoing research offers hope for further improvements in the management and quality of life for individuals with Noonan syndrome.